The science behind itchy stitches. Understanding your body's healing process. When you receive stitches after an injury or surgery, the subsequent itching can be both irritating and puzzling. This common phenomenon, while uncomfortable, actually signals that your body's intricate healing mechanisms are hard at work. Let's explore the fascinating science behind why stitches itch and how to manage this natural but bothersome aspect of recovery. The complex biology of wound healing. Our bodies possess remarkable healing capabilities, orchestrating a sophisticated sequence of biological processes when skin is injured. The sensation of itching around stitches isn't merely an inconvenience. It's a direct result of your immune system and tissue repair mechanisms operating at full capacity. The role of inflammation. At the heart of wound healing lies inflammation, a crucial biological response that sometimes gets a bad reputation. When you receive stitches, your body immediately launches a complex inflammatory cascade. This process involves the release of various chemical messengers, particularly cytokines, which serve as biological alarm signals. These tiny proteins trigger a series of events that ultimately lead to that familiar itching sensation. Cytokines perform several vital functions: recruiting immune cells to the wound site, initiating tissue repair processes, activating local nerve endings, coordinating the overall healing response. The activation of nerve endings by these inflammatory mediators creates signals that your brain interprets as itching, a sensation that, while uncomfortable, indicates active healing. Histamine's double-edged sword. Another key player in the itching sensation is histamine, a chemical that most people associate with allergic reactions. During wound healing, your body releases histamine as part of the inflammatory response. This chemical causes local blood vessels to dilate, increasing blood flow to the injured area. While this enhanced circulation is essential for healing, it also creates warmth and triggers nerve endings, contributing to the itching sensation. The 4 stages of wound healing. Understanding the healing timeline helps explain why itching occurs at different intensities throughout recovery. Let's examine each stage in detail. 1. Hemostasis, the initial response. The moment your skin is injured, your body's first priority is preventing blood loss. This initial stage, known as hemostasis, involves rapid blood vessel constriction, platelet activation and aggregation, formation of a protective blood clot, development of a protective scab. This phase typically occurs within minutes of injury and sets the stage for subsequent healing processes. 2. The inflammatory phase. Following hemostasis, inflammation takes center stage. During this critical phase, specialized immune cells called neutrophils arrive first, clearing potential pathogens. Macrophages follow, continuing the cleaning process and releasing growth factors. Blood flow increases to the area. The wound may appear red, warm, and slightly swollen. Itching often begins during this stage. 3. Proliferation. The construction phase. The proliferative phase, occurring roughly 3 to 21 days after injury, is when most tissue reconstruction occurs. This stage involves formation of new blood vessels, angiogenesis, production of collagen and other structural proteins, development of new tissue, granulation, wound contraction, establishment of new nerve connections. The regeneration of nerve endings during this phase often intensifies itching sensations, as these new connections become increasingly sensitive. Data, maturation, the final touch. The final phase of healing can last several months to years, involving continued collagen remodeling, scar tissue formation and refinement, gradual increase in wound strength, progressive reduction in inflammation and itching, managing itchy stitches, practical solutions. While itching during healing is normal, several strategies can help manage this uncomfortable sensation. TERS, immediate relief measures. 1. Cold compression therapy. Apply clean, cold compresses wrapped in thin towels. Use for short intervals, 15 to 20 minutes. Repeat several times daily as needed. 2. Proper wound care. Keep the area clean and dry. Use gentle, fragrance-free soap when cleaning. Pat dry carefully, never rub. Maintain appropriate dressing changes. Medical interventions. When simple measures aren't sufficient, healthcare providers may recommend topical anti-inflammatory medications, prescription antihistamines, specialized medications like gabapentinoids, mu-opioid receptor antagonists for severe cases. Essential aftercare guidelines. Proper wound care significantly influences healing outcomes and can help minimize excessive itching. Daily care protocol. 1. Follow medical instructions meticulously. 2. Maintain wound cleanliness. 3. Protect stitches from external contamination. 4. Avoid activities that could stress the wound. 5. Monitor for signs of complications. Warning signs, requiring medical attention. While some itching is normal, certain symptoms warrant immediate medical evaluation. 1. Infection. Indicators: unusual swelling or warmth, pus or excessive drainage, foul odor, increasing pain, spreading redness. 2. Wound complications: broken or loose stitches, reopening of the wound, excessive bleeding, severe or worsening pain. 3. Allergic reactions: widespread rash, intense itching beyond the immediate wound area, unusual swelling or blistering, difficulty breathing. Seek emergency care. The role of patient compliance. Success in wound healing largely depends on patient adherence to care instructions. This includes resisting the urge to scratch despite intense itching, maintaining proper wound hygiene, attending follow-up appointments, reporting concerning symptoms promptly, following activity restrictions, looking ahead, the healing journey. Remember that wound healing is a gradual process, and some degree of itching is a normal part of recovery. The intensity of itching often peaks during the proliferative phase and gradually subsides as healing progresses. Understanding this timeline can help patients better cope with temporary discomfort. Conclusion: itchy stitches, while uncomfortable, represent your body's remarkable healing capabilities in action. The complex interplay of inflammatory responses, tissue repair, and nerve regeneration creates this common sensation. By understanding the underlying processes and following proper care guidelines, patients can better manage their recovery journey and achieve optimal healing outcomes. Remember that everyone's healing process is unique, and what works for one person may not work for another. Always consult with healthcare providers for personalized advice and treatment options, especially if experiencing severe or concerning symptoms during recovery.